Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, what is the frustration, anger, or rage we see associated with OCD, obsessive-compulsive disorder, and OCPD, obsessive-compulsive personality disorder? So first here, it's important to understand that these are different disorders. OCD has obsessions, intrusive thoughts, and compulsions, which are behaviors that are meant to satisfy the anxiety created by the obsessions. Usually people with OCD have good insight, but not always, and we consider the behaviors in general to be ego-dystonic. So somebody with OCD looks at their own behavior, looks at the obsessions and compulsions, and they realize that they're not rational, reasonable, or desirable characteristics. Now, when we move to obsessive-compulsive personality disorder, we're talking about a cluster C personality disorder, in the same cluster as avoidant and dependent personality disorders. And here we see someone who's perfectionistic, they have a commitment to rules and order, they don't like to delegate responsibilities to someone unless that person can do it exactly as prescribed. We see a miserly spending style, so not liking to spend money. We also see a restricted range of emotion, and we consider the characteristics with OCPD, instead of being ego-dystonic like OCD, we consider them to be ego-syntonic. So somebody looks at their perfectionistic characteristics, their failure to delegate tasks, and the other characteristics, and they believe that they are rational, reasonable, and desirable. So really two completely different disorders in the way we look at them diagnostically. Now, what makes this complex in terms of figuring out the anger and the frustration and the rage associated with these disorders is the high comorbidity. This means that if somebody has OCD, there's an increased risk that they'll have OCPD, and if they have OCPD, an increased risk of OCD. So this is a high co-occurrence, again, comorbidity between the disorders. And even when somebody doesn't meet the comorbidity in terms of the diagnosis, oftentimes we still see the personality traits and behaviors of the other disorder associated with the disorder that we're talking about. So if somebody has OCD, they may still have obsessive-compulsive personality features even if they don't have the disorder. And the opposite is true. So again, high comorbidity, and it makes distinguishing the two difficult, and then figuring out the nature of anger with the two difficult as well. Now, both disorders do have an association with anger and anger outbursts, and sometimes these are referred to as anger attacks. And anger attacks are anger outbursts that have similarities with panic attacks. So they have autonomic arousal. So there would be evidence of this when somebody has an anger attack. We would see higher heart rate and more sweating and things like that. All the things we see with panic attacks. All of the autonomic arousal characteristics. So right away we see some similarities here between panic and these anger attacks. And this is important, as I'll talk about in a moment. Now, with OCD alone, so when somebody has obsessive-compulsive disorder and they have no other disorders, we don't see really an overwhelming association with anger. Where the strong association with anger comes in is when somebody has comorbid panic attacks. Now again, this makes sense if we think about the autonomic arousal piece. And when they have depression. It's estimated that about 50% of individuals with OCD have anger attacks on some regular basis. Now, what's interesting here is, other than the distress directly caused by the anger attacks, the quality of life isn't really dramatically different for somebody with OCD without anger attacks compared to somebody with OCD with anger attacks. So anger attacks aren't necessarily associated with a more severe presentation of OCD. So what about OCPD? What is the expectation for anger there? What would be the typical profile with that disorder? When we look at the research in terms of OCPD, we don't really see much discussion of anger attacks in terms of relating them to panic attacks, but rather we see personality. We see research on what the personality tendencies would be with the disorder. And what the research indicates is that with OCPD, oftentimes there's a hostile dominant personality style. Now, this isn't OCPD comorbid with OCD. This is just OCPD. So it's just this disorder, we would tend to see someone who's vindictive, over-controlling, and tends to demonstrate a lack of empathy. Now, the reason I word it that way, demonstrate a lack of empathy, is because the research has shown that the ability to empathize, the ability to understand somebody else's feelings, that ability is there, but the ability to demonstrate the appropriate emotional response, essentially to complete the empathetic response, that seems to be lacking. So an individual with OCPD has the ability to appreciate the feelings of another individual. They're just not able oftentimes to convert that into a response that would communicate that empathy. And this is something we see with a number of personality disorders. Now, when we talk about obsessive-compulsive personality disorder comorbid with OCD, obsessive-compulsive disorder, the profile changes quite dramatically. Here we see a tendency for somebody to be non-assertive and avoidant, but still we see that lack of empathy. We also see a higher comorbidity with avoidant personality disorder in OCPD comorbid with OCD. So that combination tends to have higher comorbidity with another cluster C personality disorder, avoidant personality disorder. Now, another interesting bit of information about comorbid OCPD and OCD is that there is a theory here that's supported by some research that this comorbidity may actually be a subtype of OCD. It may not actually really fall into OCPD as we conceptualize it diagnostically. So we'll have to see what research in the future reveals about this, but this is an interesting theory. So in terms of anger and OCPD, I talked about the hostile dominant personality. There's also an interesting component here when somebody with OCPD encounters somebody who's demonstrating interpersonal warmth. So when somebody's being friendly and warm to somebody with OCPD, that actually can be irritating. That can actually lead to frustration and anger. And this is the case whether the OCPD is alone or comorbid with OCD. We also see a tendency with OCPD to ruminate and fixate. So sometimes anger and hatred can build over time. So if we're trying to differentiate the anger that we see with OCD and OCPD, in general, I would say that OCD has anger outbursts that are associated with panic attacks and depression, as I indicated before, and OCPD is more of a general frustration that's a product of the personality. So there's some distinguishing factors here in terms of anger when we look at OCD and OCPD. So this is interesting, but what can we do about it in terms of treatment? What do counselors do to treat the anger and OCD and OCPD? Well, really with both, there's going to be promoting relationship flexibility and increasing emotional awareness. Remember, we see the lack of empathy kind of shared with OCPD and comorbid OCPD and OCD. Also, what's important here in terms of treatment is accurate diagnosing. These two disorders and also the comorbidity between these disorders is important to distinguish diagnostically by a counselor because it could change what kind of anger is expected and it could change some of the strategies in terms of treating that anger potentially. Another element that's important here is that OCPD may seem like an uncommon personality disorder. We oftentimes hear about borderline personality disorder, narcissistic personality disorder. The cluster B personality disorders in general tend to be more popular in the research literature. But OCPD, depending on the research you look at, may be the most prevalent personality disorder. There's a debate whether it's the most prevalent or avoidant personality disorder is the most prevalent. But either way, we know that the expectation would be that OCPD is fairly common relative to other personality disorders. So this isn't really something that a clinician wouldn't expect to see during their career. This is a disorder that a clinician would see, and they'd oftentimes see that comorbid OCPD with OCD. So this isn't something where I'm talking about a rare disorder and you really don't have to worry about it until you may get a presentation of it. It's something that really requires studying in advance and being ready for, because the expectation would be that you would observe OCPD and OCD in clinical practice. I hope you found this discussion of OCD and OCPD anger to be interesting. Thanks for watching.